I am really excited and happy to be here. Next to some of those scholars, it's amazing because I'm expert in neurosurgery, but I'm not expert in this field, and I'm learning about this field. Again, a little bit of about me. As I was introduced, I'm a neurosurgeon in this area. My education is at Hopkins in Biophysics and Islamic Studies, and I am interested in this topic. I'm the oldest of my siblings, and I have three of them passed away for neurosurgical problems. And making a decision when it comes to brain death for families and physicians is hard. Looking at those slides, you can see this great Greek philosopher saying that it is possible to provide security against other ills. But as far as death is concerned, we men live in a city without walls. We will all gonna die. So this is an important concept. This is the title of our work that we're working on. It's almost a paragraph, but hopefully just to show you how complex this issue is. I'm gonna present to you, and we're gonna look at some obscure and some philosophical, bioethical material, try to correlate that hopefully into medicine itself and then into the religion itself. And my partner, Noam Stadlan, he's my mentor in neurosurgery. He's an Orthodox Jew, and he's interested in this topic. So some of those words and lines are his as well. Now, learning objectives. Hopefully by the end of this presentation, we have to familiarize ourselves with a method that we can use systematically to analyze definitions of death. And we'll come. People define death in different terms. We have to identify common false assumptions and vague statements. Some of the presentations I did at the EENS has to do with media. They will tell you somebody was in brain dead and miraculously just woke up. It's unfortunate they were not in brain dead. Also become familiar with the prevalent Islamic approach to brain death. How does Islam approach brain death, and how those approaches shed light into the biological correlation with the presence to the soul. So Islam did not leave this issue untouched. It did touch it. Definition of death. Now, what is that quality that is so significant to a living entity that its loss constitute the death of that entity? All of us here, the majority Muslims, or who study Islamic studies, they will say it's the soul. At the end of this topic, I'm going to throw two curved balls at you guys that is going to leave you really, thinking about what does soul mean, and is this all true or not? In Islam, it is the soul. Okay, if that soul leaves this body permanently, and I'm saying permanently because we're going to come to some phrases in the Quran and understand what does permanent leave of the soul. Okay, death is a permanent departure of the soul from the body, basically. So this is what we'd like to tell you at the end of our presentation. Now, let's think about the three-tier definition of death. Tier number one, we're going to talk about this soul, like that entity. When it leaves the human body is rendered dead. The human is not human anymore. Tier number two, what are the biological states that will constitute, and they will tell us this patient or this human being is dead, and how can we confirm those biological states? I am a physician. I see a lot of patients who are dying, and I get this question from the nurses, from other doctors, from the family asking, are they brain dead, doctor? And every hospital in the United States, every organization, they have their own criteria about how to declare someone brain dead. And we're not perfect yet. We're way behind. Okay? And I'm not expanding too much because the time does not allow us to do that. Now, when we look at papers that we're going to look at, and some of the authors sitting here, they look at these things, do the tiers correlate with each other? Okay? Now, if you are talking, does the fulfillment of the tests outlined in Tier 3. For example, what are tests? For example, apnea test. For somebody in ventilation, we'll stop it, and we're going to check PCO2, which is carbon dioxide, okay, and see what's its level in the body, for example. Other test is called EEG, to check the waves of the brain. Does this correlate with the biological state of the patient or the person who's dying? And do the authors of all of those papers accept all who fulfilled that Tier 3, which is those tests, okay, that will as it did according to Tier number 1, which is when the soul departs the body. Do all of those authors agree that when the patient is not breathing on their own, when there is no brain waves, for example, and there is no blood going to the brain through some studies, do all authors agree on that concept or not? Now, to look at the biological correlation of the soul, we need some soulometer, okay? Now, and you guys going to see that comes very prevalent. The testing available, okay, we have what? We have function, imaging, anatomic, physiologic. We're going to look at those tests. So even though the soul is a religious concept, okay, it's hard to grasp the soul, and we're going to see in the coming slides that the soul is something that only Allah knows about. Okay, even though it's a religious concept, a practical definition of death requires to translate, okay, this, okay, presence or absence of the soul into a biological state, okay, determined through testing. Basically, this sentence summarizes Tier 1, 2, and 3. Now, modern medical accomplishment. What do we do now? Since like 20, 30 years ago, even 50 years ago, we have artificial respiration. We can hook up people to ventilation. They can be alive for a long, long time. We can, somebody with a heart that stopped, okay, we can continue the circulation in their body, okay? And various parts of the body can be maintained independent of each other, as you guys know. We can take the kidney of this patient, okay, even though they might be dead or anything like that, but we can keep that kidney going and alive. The questions in your head, does this kidney have a soul in it or not? Now, previous assumptions that are now false. Okay, cessation of heart function is not reversed quickly before. Okay, implies a reversible cessation of the circulation in the body. Like somebody, their heart stops, you cannot bring them back in 5 minutes. That's it, they're gone. Loss of circulation in the body implies a swift loss of all body functions. That's false. We don't do this anymore. Okay? Previously, it was necessarily to identify it was not necessarily to identify any particular anatomical or physiological or biological function that will correlate with life. Nowadays, we have to identify this. We cannot just declare someone, okay, because you stopped breathing and your heart is not beating, then you're dead. Now, current false assessment. Again, we still read this in the papers. People are still, cessation of the heart function is irreversible. So if the heart stops, then you cannot bring it back. Now, cessation of the heart function implies loss of circulation, and cessation of the heart implies loss of the function in the entire body. Okay? So basically, again, the last statement here to tell us that in the context of the achievement of modern medicine, the cessation of heart function means that only that the native heart has stopped and ceased function. It does not necessarily have the rest of the body has ceased, okay, to function. I personally have patients who will perform about 40 minutes of CPR and they come back. I had a 21-year-old female who was walking with her mom in the mall. She had severe headache. She has major hemorrhage. She came to us. We worked on her that night. Her heart rate went down to about 20. We had to resuscitate her for a long time. And now she comes to the clinic and she wants to take pictures with us and things like that. Now, vague terms. Like now people start, this is a gray area. Body versus parts. Okay? If there is a category of a human tissue that does not qualify as a human, okay, then it is necessary to establish what anatomy and physiology is needed to observe the label of body. Like, can I bring those parts of legs and heads and stuff, put them together and say this is body? We need to define this integration. Okay, this is the next step. Okay, now what is not dead is alive. So if one starts with a live human being, the body that is, it maintains its status as alive until it fulfills the criteria of death. Okay, these are the vague terms that we deal with in this kind of work, and those scholars that sitting here, they have to deal with this and try to navigate through that. Now, the consistency of the concept definition of life outside of brain death. For example, dicephalous twins, are they one or two people? Okay, somebody like with two heads. Okay, organ transplantation. We need to. So who's the donor and who's the recipient? Depends on how much you're going to take from one body and put on the other body. Isolated functioning organs, a heart that's beating by itself. Okay. Now, personal identity. If the anatomy and physiology associated with person identity, okay, is not the same as those associated with life, then there can be a human life without a personal identity, and there can also be a collection of tissue that qualify as particular person, but not considered to be a live human being. So this is an important concept between identity and human being. Someone is to identify them as being a person, and someone to identify as being what? Just a human being. You must be kidding. 2 minutes. Okay. Okay. So the definition of death, I'm going to pass this very quickly. Neurological, tier 1, tier 2, tier 3, guys saw. A non-neurological definition of death. I'll pass this. Now, analysis of current definitions of Islamic biomedical literature. I would like just, this is an ayah from the Quran, all of you guys know, and then why, do you not intervene when the soul of the dying man reaches the throat, and you, the while sit looking on upon, and but we are nearer to him than you. And this is interesting about the concept of the soul and its departure of the body as a process. It's not like one step. Those are some of the papers that we are going to discuss in our paper, hopefully. And some of the scholars are sitting next to me here. But I'm going to just very quickly tell you here, the separation of the soul from the body occurs via separation of the spirit from each and every tissue. Okay, it's not just one step. Dr. Radi, the moment of the death is the time when all signs of life have ceased, irreversible, and the soul has departed the body, and we need to complete the loss of vital organs. I just pass because literally my time is over. And just in conclusion, you have to understand something. In Islam, okay, there is a lot of talk about death, how to prepare the dead, how to respect the dead, how to do for the dead. However, there is no clear definition of how to measure if somebody died or not, what to do, what are the tools. It's all left to us. And this is what a lot of Muslim scholars, they leave this for us, okay, as medical doctors. Just in here in conclusion, the majority of the medical experts in the Muslim world has accepted brain dead as somebody who died. A large portion of our Islamic brothers and sisters in Malaysia, Singapore, and Indonesia accepted that as brain dead to be as somebody who died. But I have to tell you something. As we keep the heart beating now, and somebody is breathing, and we prove they are brain dead, to declare them dead, okay? Because I can take the machines off you, and they say you're going to stop breathing, but I can keep you breathing, and I keep your heart beating, and somebody say, oh, they are alive as long as their brain is not dead. But I'm telling you, in about maybe 20 years from now, you'll see that we will be able to manipulate and the electric waves and signals in the brain to the point that we will able to keep someone with their brain functioning, with their brainstem reflexes there, at that point, are we going to declare a different form of death? How we're going to declare someone is dead? And this is why the soul is a matter that we cannot really just grasp, you know. And I'm sorry I had to just, you know, rush through very quickly with these things, but that's it. I have to stop. You know. Thanks.